Hello, everyone. My name is Alyssa Hartwell, and I just want to thank everybody for attending my culminating presentation titled Alberta's Sexual Violence Epidemic, Breaking Down Barriers for Indigenous Populations. Before I begin, I do want to acknowledge that it's with great gratitude that I live, love, and work on the traditional territories of the people of the Blackfoot First Nation, including the Siksika, the Piikani, the Kainai, and the Stoney Nakoda First Nation tribes of the Chiniki, Bearspaw, and Wesley, as well as the Tsuut'ina First Nation located in the Treaty 7 region of southern Alberta. Over the last 3 months, I have completed my practicum at the Association of Alberta Sexual Assault Services, otherwise known as ASAS. They are a non-governmental umbrella organization that provides leadership, support, and an arena for intersectoral collaboration amongst numerous provincial stakeholders. In total, ASAS oversees 14 sexual assault centers across the province. In 2016, they released Alberta's first ever and still only Alberta Sexual Violence Action Plan. My report conducted a gender-based analysis plus of the plan with service delivery recommendations for sexual assault centers to meet the needs of Indigenous individuals who've experienced sexual violence. My report only skims the surface of a vast subject matter. I did observe a couple of gaps in the literature in two main areas, the first being Indigenous women's experiences of sexual violence, as well as Indigenous adult experiences of sexual violence. The majority of the literature focused on Indigenous child sexual abuse. Additionally, a full GBA process wasn't able to be completed just due to time constraints and the need for ethics approval. The final process being stakeholder consultations. Sexual violence is not a sex, but it is a crime of power and control whereby sexual activity is used as a weapon. GBA Plus peels back structures that uphold and perpetuate public health issues like sexual violence to reveal power and control at the crux of the issue. By conducting a GBA Plus analysis, I was able to find a couple key areas of concern within the Sexual Violence Action Plan. Firstly, it lacks tangible recommendations for action that sexual assault centers in Alberta can implement, and also the plan doesn't fully address vulnerable populations and the ways that the social determinants of health intersect to inform people's unique experiences of sexual violence. As my presentation will provide a quick overview of the prevalence of sexual violence among Indigenous people of Alberta, their unique needs and barriers to accessing services, and recommendations to increase access to services. So let's begin by taking a look at prevalence. Within Canada, it's estimated that a total of 4.3% of the population identifies as Indigenous. However, Indigenous women experience sexual trauma at a rate 3 times higher than the national average, and it's usually increased in severity. Ultimately, this leads Indigenous populations to encounter many chronic and preventable health conditions, which also leads to lowered life expectancy and lowered quality of life. This brings us to looking at the needs of Indigenous populations. My project looked at sexual trauma across the lifespan in order to match the way that it was measured in the ASAS prevalence study, which I was fortunate enough to show during my practicum. Sexual violence is more likely to affect Indigenous girls under the age of 18, those who are unemployed, those from low socioeconomic status, or any combination of these demographic factors. Taking a look at the graphics I've provided, the one on the far right comes from Stats Canada and indicates areas that are most densely populated with Indigenous people. The graphic in the middle is a visual of where Alberta's sexual assault services are. When we take a look at these two graphics, we can already begin to see where there are some noticeable gaps in service delivery. Recently, Canada has had significant social policy responses to violence against Indigenous populations. Such policies include the ones that we see here. With the federal government setting its mandate, the problem that is facing Alberta sexual assault centers is how to adapt and adopt these macro-level policies and implement them into day-to-day practice. Therefore, I went through each of these documents and pointed out each article, chapter, or call to action that would apply to sexual assault centers in order to inform my recommendations. Despite the prevalence rate of sexual violence amongst Indigenous populations, many of Alberta's sexual assault centers are not seeing an influx of Indigenous survivors accessing their support services. A review of the literature was also conducted in order to discover the best ways to increase access and assist Alberta sexual assault centers in breaking down high-level policy recommendations into pragmatic implementation strategies. From my lit review, I found two guiding principles underlie all subsequent themes. The first is two-eyed seeing, and the second is cultural safety. Each of the subsequent themes I found can be broken down into two main types of service delivery: capacity building and moving towards allyship. Under capacity building, I found that colonialism and intergenerational trauma were two themes that were often discussed together. Likewise, the medicine wheel and holistic healing also comprise part of capacity building. I do want to note that the second type of service delivery was titled moving towards allyship because it's ultimately up to Indigenous communities to decide who is an ally. However, we can move towards allyship through understanding the importance of relationships and intention setting and the role of Indigenous female leadership. Best defined, two-eyed seeing is the fundamental understanding that both Indigenous and Westernized knowledge are valuable and can coexist. Literature does suggest a few ways that two-eyed seeing could be applied within organizations, including a blended approach between a Westernized counseling model and Indigenous healing practices, intersectoral collaboration with Indigenous-led associations, and consultation with Indigenous communities on any and all matters pertinent to health and well-being. Cultural safety is a framework of intelligibility whereby a culture is better understood through its historical and social underpinnings through which power imbalances are rendered visible. Often this is in relation to the colonialist impacts on health and well-being. Colonialism is described within a particular geographic and political context as Indigenous peoples' forced disconnection from land, culture, and community by another group. Therefore, colonialism is understood as the backbone of all Indigenous oppression, which leads to significant health impact. This also provides a crucial concept worth understanding to alleviate unintended potential harms caused by sexual assault centers when they reach out to Indigenous communities. Intergenerational trauma, as it relates to Indigenous peoples, presents an accumulation of complex and intertwined barriers to receiving care post-sexual assault. This includes colonialism, racism, physical, sexual, emotional, mental, spiritual, and cultural violence that's extended over multiple generations. The medicine wheel is most often used to conceptualize best practices for healing from trauma from an Indigenous point of view. It encompasses a holistic approach involving 4 domains: emotional, physical, mental, and spiritual, with several central tenets, including wisdom, honesty, bravery, and respect. Holistic healing provides the opportunity to move beyond medical, counseling, and psychosocial models. The lack of Indigenous-informed supports within mainstream services is a serious gap in meeting the needs of Indigenous survivors. Relationships are significant to Indigenous communities because they serve as the crux for their entire cultures. It's paramount for sexual assault centers to organically grow their partnerships with Indigenous communities while simultaneously understanding that they should not accept reciprocity. Scholars acknowledge intention setting is about opening oneself up to vulnerability and to see oneself as having a role in colonial silos and interventions. Strong Indigenous female leadership is found in autonomous, influential Indigenous women who lead by example the lifeblood of their communities. Inspiring examples of Indigenous female leadership would be the likes of Lorraine Whitman, Autumn Pelche, or Mary 2X Earl. While I do wish to make clear that all Indigenous women are important beyond the confines of any list, within my research and for the purposes of my analysis, I found that they're important for 3 interlocking reasons. The first is that they are crucial to relationship building in Indigenous communities. They are the most at risk of experiencing sexual violence, and they are often the first to receive a disclosure. This brings us to a few of my recommendations. I made some lengthy recommendations with the help of my supervisor, Deb, but I did also give these deliverables for the Senior Leadership Committee to review. So that includes all of the executive directors and CEOs across the Alberta Sexual Assault Centers. So one example was intentionally setting aside some time to learn and reflect on their social location and systems of power that oppress Alberta's Indigenous populations once every quarter. And another was to consider instituting a no waitlist policy for Indigenous survivors requesting counseling within the next 3 months. I want to conclude my presentation acknowledging and thanking the following people. Deb is an absolute rock star, and I have learned from the best, and all of my colleagues at ASAS. I so appreciate being welcomed with open arms every day that I came into work, as well as help from Victoria, Renee, Jess, and Andrea, who took looks at earlier versions of my report, as well as all of my family, friends, and my colleagues in the MPH program, and all of us who started out in 2017. I do also want to acknowledge that this report is dedicated to my late grandmother, Angela. She is my inspiration, and she taught me so much about the importance of giving back to my community. Thanks again for your time, and if there's any questions, I'm happy to answer them now.
Wonderful. Thank you so much, Alyssa. Your enthusiasm for this project and your appreciation and your gratefulness with which you accomplished the project is so loud and clear. I so appreciate your presentation this afternoon. Okay, does anybody have any questions for Alyssa? No. Oh, wait, I think we might have just a sec. Oh, wait, Nigel?
Oh, goody.
A great presentation. I mean, obviously very disturbing and upsetting in many respects. I just wondered how much research is being done on the perpetrators of this, sexual violence, as opposed to the survivors and victims.
There's a lot, and I do talk about that in my paper, that often in Indigenous communities, there is a component of intrafamilial violence that can happen, in part because of all of, like, it's essentially an iceberg of all the various traumas that they've sustained. And of course, we know all of the ways that the social determinants of health intersect for all of them. But the overall, I think that, I mean, it kind of depends on your political ideology as to which one you want to look more at. And for me, I've found it really inspiring to focus more on the survivors and how we can help them. The perpetrators or the perpetrators rather, will be handled through a criminal justice system. They also can go through rehabilitation systems. And I did find some work about restorative justice and that approach, but did have to leave that out just for the purposes of streamlining my report.
Thanks very much. It's fascinating, and as I said, very disturbing area.
Yeah.
Any other questions for Alyssa? I have one quick question, but perhaps I would give other participants a chance as well to ask questions. Any other questions for Alyssa? Okay. Alyssa, I know that you're, and you mentioned in a slide or two before this last one that you prepared a number of recommendations for the association.
Mm-hmm.
Where is that going now? What are the next? Oh, thank you for putting that back up. What are the next steps in terms of their taking your analysis and moving it forward in some way?
So they will, I gave an executive summary as well as my full report to Deb, and she of course chairs over all of these associations. So that work will now go on to the senior leadership committee for them to look at my executive summary and my report if they would like, and then look at the recommendations and consider talking about that as a team, whether they implement it, all that sort of a thing. So it's kind of up to them at this point, but it has been presented to essentially all sexual assault centers across the province to decide which one would like to implement and the research behind why they should, as well as how it corresponds with a number of really important social policies that have come out.